All right, thank you everyone for joining us for this third in a series of Toronto by name list and coordinated access community of practice calls. Toronto began with an overview of their rapid rehousing initiative. The second call was to look at how they're using data to reduce returns to homelessness. And this third call in the series is focused on an overview of Toronto's priority access to housing and supports, or PATHS, policy development and practical application. I invite you to take this opportunity to put your own land acknowledgement in the chat. From coast to coast to coast, we acknowledge the ancestral territory of all the Inuit, Métis, and First Nations people that call this land home. I'm located in Kitchener, Ontario, which is situated on the Haldimand Tract, land that was granted to the Haudenosaunee of the Six Nations of the Grand River, and is within the territory of the neutral Anishinaabe and Haudenosaunee peoples. My name is Marie Morrison. I'm the Director of Built for Zero Canada with the Canadian Alliance to End Homelessness, and I am your host for today's webinar. Our primary presenters today from the City of Toronto Coordinated Access Team within their Shelter Support and Housing Administration Division are Pauline Vivianco, and I'll get her just to give a wave. She's the Project Coordinator with the City of Toronto's Coordinated Access Team. Paulina has over 15 years experience working in the not-for-profit sector on issues of housing and homelessness, and is committed to advancing efforts that address systemic inequities. And we also have Lindsay Allen. She's been working with the City of Toronto since 2020 and is currently a program officer providing leadership to the Coordinated Access Operations Team. They are responsible for prioritization, matching, and referring people to housing and supports. Before joining the City of Toronto, Lindsay spent 16 years in the not-for-profit sector with her work focused on planning and implementing policies, programs, and services that meet the complex needs of people experiencing or at risk of homelessness. And I know there's a number of other City of Toronto operations staff who are on the call today to be able to join in and answer questions later on in the presentation. So welcome and thank you to all of our presenters today. This webinar is being brought to you by the Canadian Alliance to End Homelessness, which leads the national movement of individuals, organizations, and communities working together to end homelessness in Canada, and includes the 6 key initiatives that you see listed here. I'll just put in a little plug for the conference. The registration went out. The call for presentations is live. We encourage you all to check that out. This by name listing coordinated access support for communities is funded in part by the Government of Canada through the CCI funding stream of Reaching Home. This webinar is part of a series of monthly webinars and community of practice calls that ran from the fall of 2019, actually till March. And this is our last one in this 3-year series of webinars. You can find all previous webinars and anything that's upcoming on the Training and Technical Assistance website that you see listed here. And just a bit of housekeeping, the call today is being recorded. The recording and the PDF of the presentation will be sent out within a few days to all those who registered. It will also be posted on that website page under webinars, archived webinars. Closed captioning is enabled. You can choose to view it or not. Everyone is muted. Please use the chat and the question function to make comments and ask questions. And with no further ado, I'm going to turn it over to our presenters. Welcome. And I'm going to stop sharing so they can share their screen.
Thank you, Marie. Give me 1 minute to get that up. And hopefully you're seeing the presenter mode.
Yes.
Yes. Okay, great.
Looks good.
Okay, so I will get us started. Hey, everybody, good afternoon, and thank you for joining us today. As you know, we're here to share what prioritization as part of the coordinated access system looks like in Toronto. And while we are going to get into the policy and operational details later on in the presentation, we thought it would be good to spend a little bit of time up front providing some context about homelessness in Toronto, where coordinated access sits within our homelessness response system, as well as review our governance structure. Next slide, please. So the slide that you see here highlights some key findings from our last street needs assessment. The SNA took place during the middle of the pandemic in the spring of 2021. And as a result of this timing, the profile of those experiencing homelessness changed from that of previous year's results. This is in part why the estimated number of people experiencing homelessness that you see here in this slide is actually lower than in previous years and lower than what it is currently. Since the summer of last year, so basically just a few months after the SNA was completed, we have continued to see those numbers go back up. And as of February 2022, Toronto registered about 9,500 people who were actively homeless in the last 3 months prior to that. So what we wanted to do as a starting point for today's conversation about prioritization is to first paint a picture of Toronto's homelessness context. And to do that, I want to point out a couple of key highlights from the street needs assessment. One, we found that while most people access bedded programs exclusively, a significant percentage of folks stay inside and outside throughout their experience of homelessness. A smaller percentage of folks stay outside exclusively. When we dive deeper into our policy, you'll see that we try to respond to this in our prioritization approach. And secondly, while we know that homelessness affects people from all different backgrounds, there are specific population groups that are overrepresented in our homelessness system. And as we share later on in our presentation, our policy aims to have a positive equity impact on these systemic disparities. Next slide, please. So in addition to that very quick overview of the key findings from our street needs assessment and the rising number of people who are experiencing homelessness currently, we also wanted to frame today's conversation within a broader discussion about coordinated access and where this approach sits within our Toronto's homelessness response service system. This image is from our Homelessness Solutions Service Plan, which just was released towards the end of last year, depicts Toronto's homelessness service system. People enter the system through a range of touch points, such as bedded programs or through engaging with street outreach services. When that contact happens, an assessment is conducted, which is split into 3 distinct components: a triage, a housing plan, and for those who need it, a supports assessment to better understand what people need to be able to move to housing quickly and to be able to maintain that housing in the long term. Using tools like navigation supports, referral pathways, prioritization and matching, people are moved to a variety of housing opportunities. Next slide, please. Lastly, before jumping into our policy, wanted to quickly share with you what our governance model looks like, because we use a co-design approach to all aspects of developing and implementing a coordinated access system in Toronto. We work with 2 community advisory boards. One is the Toronto Alliance to End Homelessness and the Toronto Indigenous Community Advisory Board. Both of our community advisory boards have coordinated access subcommittees that we work very closely with, and we also work closely with their respective steering committees. In addition to that, we have a number of working groups that are up and running, and we're constantly engaged in user research processes to assess how our systems are working or not. And there are a number of important partners and stakeholders we work with on all things coordinated access related, including TAEH's People with Lived Experience Caucus and SSHA's Confronting Anti-Black Racism Unit. All of that to say that Toronto is big and it's complex. And what we try to do in our approach to developing and implementing a coordinated access system is to center those complexities in all that we do. Next slide, please. Thank you. So regarding our prioritization policy, our development partners are TAEH, the Toronto Alliance to End Homelessness, the Toronto Indigenous Community Advisory Board, or TCAB, and some key internal partners, including the Coordinated Access Leadership Group, which is an internal body, and SSHA's Confronting Anti-Black Racism Unit. Next slide, please. A little bit about TAEH. TAEH formed through collective action and explicitly adopting a collective impact model for governance, decision-making, and action. TAEH's vision is for a Toronto where homelessness is rare, brief, and non-recurring. TAEH is an ecosystem of community partners committed to the same vision and working on shared priorities. And some of the member agencies that are part of TAEH include CMHA, Covenant House, the Access Point, the Wellesley Institute, the United Way of Greater Toronto, and several other partners. Next slide, please. Our other Community Advisory Board partner, TCAB, works with the Indigenous community entity on the goals of eradicating Indigenous homelessness in Toronto. It is made up of the Indigenous housing and homelessness service providers in the city. Like TAEH, TCAB has a dedicated coordinated access subcommittee, and any work related to the development of coordinated access is usually reviewed by the TCAB coordinated access subcommittee first, and within that role, the subcommittee makes recommendations from an Indigenous perspective, and these recommendations are brought to the broader TCAB for review and a final decision. The decision-making approach within TCAB's coordinated access subcommittee is a consensus building model where everyone is given the opportunity to offer input. Ample time is allowed for open discussion, keeping in mind what is in the best interest of the subcommittee and the larger TCAB. And some of the member TCAB agencies, you see their logos here, include Native Men's Residence or NAMIRES, Native Women's Resource Center, Wigwamin, Andayan, Anishinaabe Health Toronto, and Native Canadian Centre of Toronto. Next slide, please. Okay, so now we're going to jump into the policy and its implementation. Next slide, please. To start, I wanted to highlight the extensive and lengthy process that has gotten us to this point in terms of the development of the prioritization policy. The coordinated access team worked closely with both CABs to research and explore the various approaches to prioritization in Canada and also in the US. And drawing on all of those examples and taking into consideration the strengths and weaknesses of those, a full planning day took place in November of 2020 with the goal of engaging the broader sector on what approach would be the best fit for Toronto. In many places, municipalities use an acuity score or first come, first served approach to prioritization. And at that planning day, we heard loudly that Toronto's approach needed to be different, which led us to land on an allocation-based approach where resources are distributed between, or were distributed between 4 priority population groups. And those groups were people experiencing chronic homelessness, Indigenous people, youth, and chronically homeless seniors. We adopted that interim approach while we continue to engage both CABs as well as the SSHA's Confronting Anti-Black Racism Unit. And through that process is what led us to where we are now, which is an equity target-based approach rather than allocation approach, and I'll get into that in the next few slides. So when we started implementing a prioritization approach, length of homelessness as recorded in SMIS, which stands for Shelter Management Information System, which is what we use instead of HIFIS, was the main consideration. Additional consideration was made for people sleeping outdoors and for Indigenous people experiencing homelessness. After the planning day in late 2020, we moved to the interim allocation approach, where 1 in 4 units were allocated to the 4 priority population groups. And again, that's seniors, chronically homeless seniors, youth, Indigenous people, and the general chronically homeless population. Following ongoing review of that and consultation, we've landed on an equity target approach where a number of different population groups, which are overrepresented among those experiencing homelessness, are prioritized for housing opportunities available through our PATHS process. Next slide. So as Lindsay will review with you shortly, the information that informs the prioritization step within our process is collected through the first part of our common assessment tool, which is our intake and triage, which collects demographic and basic supports needs information. The common assessment tool we use, which is called Service Triage, Acuity and Referral Supports, or STARS for short, does not produce an acuity score. Rather, minimum targets are established for each priority population group that I'll speak to in a second, and this is what drives prioritization. The principles that have emerged and that guide our prioritization approach are aligned with the city's Homelessness Solutions Services Plan, the most recent results of the 2021 Street Needs Assessment, and the Housing TO 2020 to 2030 plan. Next slide, please. So why doesn't Toronto use an acuity score? Through our research and consultation phases, we learned and heard that numerical scoring reproduces racial and gender biases. In the United States, studies have shown that Black people receive lower VI-SPDAT scores on average and are less likely to receive housing opportunities as a result. Black women receive lower scores than white women despite similar histories of trauma. In Canada, an evaluation of the VAT found that Indigenous people receive lower scores on average also. Studies on the VI-SPDAT and the VAT also identified that these tools do not adequately capture women or youth experiences of homelessness. Also, we heard that scores are traumatizing and are not aligned with Indigenous worldviews. Pilot projects in Toronto and reports from various municipalities have indicated that clients and service users find acuity scores stigmatizing and traumatizing. Indigenous service providers and service users across Canada have repeatedly expressed opposition to acuity scores as an approach that is not aligned with traditional values, is traumatizing, and is reductive. The revisioning coordinated access report linked assigning someone a number on to the numbers assigned in residential schools. In Ottawa and British Columbia, Indigenous providers are developing and using alternatives to the SPDAT and the VAT. Additionally, we found and read that scores are not useful. Pilot projects using the HSAT indicated that case managers, housing workers, supportive housing providers, follow-up support service providers, and coordinated access operations staff did not find numerical scores helpful in matching clients to housing units or supports, understanding their support needs or delivering services. The other important piece here is that support needs change frequently. Our own user research in Toronto identified that a client's support needs are contextual and highly impacted by current living circumstances and environment, and therefore can change frequently. A score in a database may not be an accurate representation of someone's current need levels and could impact a client's access to services. And then lastly, we read and heard that scores can lead to coercive dynamics and quote unquote gaming. Clients have reported feeling coerced into disclosing information they otherwise would not have in the hope of receiving housing. This can be traumatizing, particularly when the client has no relationship with the assessor and receives no follow-up support or debriefing for the life events and challenges they may just have disclosed. Other clients and service providers have reported gaming, meaning when people know that a higher score could lead to a housing opportunity, they know that the more times they say yes to questions, the more likely they may be to receive housing. Next slide, please. Okay, so now we've arrived at the substance of our policy. The prioritization policy that has been approved by both our community advisory boards and is now in effect is grounded in 3 core principles, which will guide decision-making about which households are identified for PATHS opportunities across the homelessness response system in Toronto. The 3 principles are length of homelessness, which prioritizes chronically homeless households and those with longest lengths of homelessness. Indigenous homelessness, which prioritizes Indigenous households experiencing homelessness. And the 3rd principle is equity impact, which prioritizes equity-deserving population groups overrepresented in the homeless population, including youth, seniors, Black people, other racialized people, women, and 2S LGBTQ+ folks. These prioritization principles are layered onto any additional program-specific eligibility criteria, which are a separate and distinct component of the matching process. So PATHS prioritizes these population groups for access to housing and support opportunities through an equity-based minimum target approach, meaning for length of homelessness principle, a minimum 75% of households matched to a unit through PATHS are people experiencing chronic homelessness, with further priority given to people with the longest experience of homelessness. For Indigenous homelessness, a minimum 25% of households matched to a unit through PATHS are Indigenous people experiencing homelessness, and Indigenous people do not need to meet chronically homeless criteria. And for equity impact, a minimum 25% of households matched to a unit through PATHS are youth experiencing homelessness, and an additional 25% of households matched to a unit through PATHS are for chronically homeless seniors, so age being one of the equity impact considerations. A minimum 25% of households matched to a unit through PATHS are Black people experiencing homelessness, and an additional minimum 25% of households matched to a unit through PATHS are other racialized people experiencing chronic homelessness. A minimum 15% of households matched are 2S LGBTQ+ people experiencing chronic homelessness, and a minimum 40% of individuals matched are women experiencing chronic homelessness. So if you were writing those percentages down, we know that they don't add up to 100. And that's because people experiencing homelessness have intersecting identities. And this approach is an important first step in its intent to have a positive equity impact on all the population groups that are overrepresented in our system. Here, I also want to point out that in lieu of an acuity score, length of homelessness becomes the final consideration when prioritizing someone for access to resources. And now I'm going to pass it on to Lindsay, who's going to take a deeper dive into how this is operationalized.
Thanks, Paulina. So one thing we quickly learned in our journey with this policy is that it's one thing to say something in a policy and another thing entirely to figure out what that looks like in operations. While the operations team with coordinated access was included in the policy's development process, there have been unanticipated gaps that we continue to work together to resolve. So the priority access to housing and supports, or PATHS, is a prioritization-based approach to identifying and referring tenants to housing with supports programs. PATHS offers city-funded supportive housing through, though will work in partnership with other systems for projects receiving non-city funding. Supports are available and provided on site, usually in dedicated supportive housing environments. Target tenant populations through PATHS usually require higher supports when compared to rapid rehousing and other independent living programs. As this group is very familiar with the by name list, the point we wanted to drive home through this slide is that currently across Toronto, there is a proportion of people experiencing homelessness who are not being captured through the by name list. Based on data from the 2021 Street Needs Assessment, we know that at least 80% of people experiencing homelessness in Toronto are on the by name list. We are in the process of working with Toronto's street outreach programs to bring client information for people sleeping outdoors onto our SMIS system. This population makes up roughly 10% of the uncaptured homeless population across Toronto, or population that's not currently on the by name list. Once on SMIS, people sleeping outdoors will appear on the by name list, and this work is already underway. The remaining 10% is split between the VAW sector, health facilities, and correctional facilities. This slide shows PATHS operational workflow and the tools used to embed prioritization. First off, PATHS operations staff are informed of available housing and support opportunities. SSHA works closely together with the Housing Secretariat, housing providers, and operators early on to formalize the PATHS processes of applying funding and provider eligibility criteria and prioritization principles. These details are embedded within the funding agreement and access plans, as well as the unit descriptions that are used to support effective matching and referrals to supportive housing through PATHS. The next step focuses on using the by name list to support eligibility and prioritization. To match people experiencing homelessness to the right housing and support opportunities, PATHS operations staff apply funding, provider, and prioritization criteria to filter the by name list. A comprehensive intake and triage has been built into Toronto's Shelter Management and Information System, or SMIS, and helps to capture the data needed for filtering capability. Clients who are top of list, once the filters have been applied, are identified. Then PATHS operations staff refer to a prioritization allocations tool that supports front-end unit distribution by sector in order to build towards equity targets. We will show you what this tool looks like in an upcoming slide. Sites where identified clients are staying are then notified when clients are top of list at their location and provided with the unit description of the housing and support opportunity that is available. As noted already, we are working to bring as many people experiencing homelessness as possible onto our SMIS data bank so that they appear on the by name list. While that work is happening, we ensure dedicated allocations to street outreach providers so that people sleeping outdoors also have prioritized access to housing with supports opportunities. As mentioned, there are additional work, or as mentioned, there are 10% of people experiencing homelessness that may not be captured through the by name list at this time, but workarounds are in place to support those populations, including, for example, the VAW sector. Then the assessment and matching process happens. Once sites receive the information about an available supportive housing opportunity, they provide PATHS operations staff with the client's common assessment that was described briefly by Paulina earlier on. This tool offers detailed insight into the type, frequency, and intensity of supports that the person would likely need to stabilize and maintain housing. Operations staff review this tool to ensure the supports available through the unit on offer are a good match for the client. With the client's choice confirmed, operations staff then send the referral to the housing provider, who again confirms the match. When a lease has been signed, PATHS operations receive a housing outcomes form from the housing provider, which finalizes the match as being successful. Operations staff use the housing outcomes form and a client profile analysis to monitor progress towards prioritization targets on the back end. This also allows for any necessary adjustments to the allocations across sectors to be made in a timely manner to ensure equity targets are met. It should be added that housing providers and operators are given comprehensive training that includes knowledge of the operationalization of the prioritization policy through onboarding and recurring scheduled site visits. SSHA also has an Indigenous program coordinator that is employed through a joint partnership with the Aboriginal Labor Force Development Circle and the City of Toronto to support a coordinated access system that is responsive to Indigenous clients and organizations. This position oversees the matching and referrals process for all Indigenous clients exiting homelessness to supportive housing through PATHS. Here is a sample of the by name list. We use Tableau to visualize our daily by name list and have embedded our prioritization criteria into the dashboard design. As you can see here, we are able to filter using prioritization categories, including chronic homelessness or chronicity, Indigenous people experiencing homelessness, seniors and youth experiencing homelessness through our age criteria, women who are experiencing homelessness, and clients with a history of sleeping outdoors. We are currently doing work to improve our ability to filter for data on gender identity, sexual orientation, and racial background. We are still in the process of defining this data specifically, but in the meantime, we have taken the initial step by collecting this data. This is a sample of the prioritization allocations tool that is used at the front end to support work towards equity targets across sectors. The tool provides a breakdown based on prioritization targets. As noted, you can see where people sleeping outdoors are prioritized by designating allocations to street outreach providers. This tool captures allocations, not necessarily outcomes. There may be situations where the allocations do not end up with a successful housing outcome, but that is why we work with back-end monitoring resources as well, which we will look at next. As stated, we are in the process of developing back-end tools to help monitor how well we are actually meeting prioritization targets. Currently, we have a client profile analysis that we are looking to enhance by adding additional information about how we are meeting the equity targets from the prioritization policy. As you can see here, we can filter for the housing and supports portfolio, in this case PATHS, and then the tool will rely on housing outcomes data to demonstrate the percentage of, for example, seniors who have had successful housing outcomes. This insight is then brought back up to the process of allocations to ensure we are being intentional about who we are prioritizing as new housing opportunities become available. Again, we are also able to use this data to make timely adjustments if there are gaps in meeting the prioritization targets. This is a sample of what we are conceptually looking to use for monitoring in the near future. It relies on the same data currently available, but uses a different format to demonstrate prioritization outcomes that are easier to use operationally. I will pass it back to you, Paulina.
Thanks, sorry, I was muted. So we thought we would wrap up with just a quick overview of some of the process improvement areas that we're working on for this year and attach them to sort of where those improvement areas sit within the operational workflow. So with regards to the initial stages around vacancy, we're working to develop and improve our current resource inventory to more clearly identify eligibility and ineligibility criteria. That's very much connected to developing that referral dispute policy, which is also included in this chart. We're also testing the operational feasibility of the allocation approach that our rapid housing team uses, which Lindsay just showed you a few slides back, which is by sector, which are intended to support our equity outcome targets. In regards to the by name list prioritization, we are going to be working closely with our agency partners that work with folks not currently on the by name list to improve access to those folks for their access to coordinated access resources, including street outreach services. Although we're a bit further ahead with that piece, but other sectors not funded by the city and people experiencing homelessness that are therefore not on the by name list, that's a priority for this year. A big to-do again is developing the referral dispute policy, and then an exciting piece of work that a number of us on the call here are really interested in is developing a policy monitoring committee. So when we got our prioritization policy approved, we built in a minimum yearly review component to it. And what we want to move forward with is a collaborative monitoring approach that is continuous rather than just have like a yearly one-time policy review process. Build that in as part of our bigger quality improvement process. And that's it. We're happy to take, there's a number of us here who are able to respond to questions.
Amazing, thank you. I'm just gonna pull up my screen for questions. Oh, sorry, I'm working through your entire presentation to get to the questions. I apologize. This is where we are now. Questions for our presenters. Thank you, everyone. I just want to say that was so thorough and well explained and very clearly data informed. And you so clearly have Indigenous and non-Indigenous partnerships, attention to equity, consideration for lived experience voice. And I just really loved how action focused and fail forward it was. Like you didn't have it perfect from the start, but you started somewhere and then showed us how you've been continuing to improve over time, which is really amazing. So thank you for that presentation. And we do have some questions here right now. Encourage others to put those into the chat or the question box. So we have a question about, could you tell us more about People with Lived Experience Caucus? How are members supported, and like compensation, transportation, technology, peer support? How often are they engaged, and what types of decisions do they help inform or direct?
I can take a first go at that. So the People with Lived Experience Caucus is an initiative supported by the Toronto Alliance to End Homelessness. So I can't speak to all of these questions. I do believe that they get some type of compensation. Since I joined the city, it's all been virtual, so I don't really know how it worked before in terms of transportation or even what support folks received in terms of technology to support an online meeting environment. So I can't really say much more than what support they get from TAH. I know that they have like a staff person who supports them in a really meaningful way, and she works closely with our team. In terms of how we engage them from a coordinated access perspective, it's usually we engage the committee on most of the tools that we develop or the policy, like, yeah, we consult with them quite regularly. And in addition to that, there's a person from that caucus who sits in the broader steering committee. So that I think the intention is for that communication flow to be ongoing between the steering committee discussions and the People with Lived Experience Caucus. I don't know if others on the call can speak more to that.
I think you covered anything I know.
Okay, that's great. Okay, we have a number of questions about the STARS tool. You know, did you create it and develop it? Would you be willing to share it? Where are you at with the tools right now?
I can jump in if that's helpful. So the tool itself has been designed over a very long period of time through ongoing consultation with, you know, a number of community providers, are, you know, partner agencies for follow-up supports, interdivisional consultation work, you know, certainly a lot of review of relevant literature to support, you know, along the way. The tool was, oh, Allison's here. I didn't know Allison was here. Hi, Allison. Did you want to jump in? You're definitely better to talk about it. I'm sorry I didn't see you there. I'm
going to make it so Allison can talk.
So Allison is the lead on that piece of work. Yeah.
Yeah, you should be able to unmute now, Allison, if you wanted to share more.
Can you hear me?
Yep.
Yeah. No, I mean, I think you did a fantastic job, Lindsay, describing it. I'm very happy for you. You were a huge part in the final design. And I mean, yeah, that was something we did. We really very intentionally worked closely together with Indigenous partners in Toronto, as Paulina was highlighting, with our operations team, with a number of pilot sites, with service users. We did engage with the People with Lived Experience Caucus, but we also did some pilots where we, you know, used the tool and then got feedback from both the service providers who had administered it and also the service users who had experienced it, so we could get that kind of very direct experience feedback. Yeah, and we're very happy to share it. I think, sorry if I'm blanking on other components of that question, but yeah, we'd be very happy to share that tool.
That's great. And there's two parts to the tool, right? There's a triage, intake, and then some assessment.
Yeah, there's actually, sorry, there's three parts to the tool actually. So we have one part is the intake and triage, and that's both an intake to, you know, a particular program, for example, a shelter program or street outreach. There's a housing checklist, which is done by a caseworker, which is kind of looking at the basics, you know, valid ID, source of income, various documentation needed to access particular housing opportunities, and some other information regarding different types of housing with support opportunities that people may be eligible for, and some population-based supports as well. And then, so that's the second component. And then the third component is I think what people mostly think of when they think of the assessment tool, which is, it's really the assessment piece, which is the supports assessment. It digs into kind of more about what's been going on from a mental health or physical health or substance use perspective, from a housing stability or a housing history perspective. And that tool is called our supports assessment. And that's the one that is used to link people, to match them to services and supports through to paths or to rapid rehousing or other programs, follow-up supports. And Lindsay can certainly speak more to that piece as well.
Yeah, I think, you know, as Allison mentioned, we'll certainly be able to share that that resource. And in terms of the matching, how it supports matching, it's really about understanding that the focus of the tool is to, you know, think about what areas are you know, evidenced to have the greatest impact on housing outcomes, and to be able to build in very, you know, intentional questions that help to understand that for a person, and then to think about how that connects to a housing and supports opportunity that would be a good fit for that client. So it's very client driven, it's quite goals oriented. And yeah, it sounds like we're able to share that, which is really great. I think in terms of one of the parts of the questions was where it's at, and so very exciting that that's very recently been approved, and we are right now kind of knee deep in, and I'll say we, it's Allison is very much again leading, developing some training to support the rollout of a paper-based version of the supports assessment component. The triage and intake is already built into SMIS, and I believe the housing checklist is also, correct me, Allison, is also in SMIS at the moment. So it's really that support assessment piece that we're rolling into paper-based version until we're able to get that also onto our SMIS as a digital tool.
Perfect. This has been a question at every webinar, and I'm just seeing a note from Stephanie saying she's emailed so we can schedule a webinar to present the tool. Definitely. So that sounds great. Stephanie will follow up around that. All right. Thank you for all of that information. People are very excited on the line to hear more about that tool. Okay, some questions now about your prioritization criteria. So one of them was around, I just have to go back up and find it here. Length of time homeless. Is that cumulative for their entire life or in the last year? Like, does it follow the chronic definition? How do you handle episodic homelessness? How are you capturing that information?
So in regards to the policy, it's cumulative. So when the operational flow begins, we do organize the short lists by chronic homelessness, and then as a secondary consideration, longest length of homelessness. That said, Indigenous people and young people do not have to meet that chronicity definition.
They just get pulled forward automatically.
But organized by length of homelessness, which is cumulative over since they had their first interaction with our response system.
Oh, okay, I see, that makes sense. That's great. Okay, so one of the other questions is, you mentioned 1 in 4 units to each of these population groups. Does this refer to housing units directly allocated to people experiencing homelessness, or are you also prioritizing access to caseloads for case management programs? So is it units or is it all the programs?
So the 1 in 4 units approach, the allocation approach, was kind of what we were using previously, previous to the equity target approach, but everything we've spoken about today is with regards to units. So municipally administered supportive housing units. We are building out this policy to also include rapid rehousing, and that's on the work plan for this year as well, to look at those equity targets that use the same principles to guide prioritization, but looking at those targets and seeing if there's any specificities to that housing resource that we need to account for in a different way. And then Lindsay, I don't know if you want to add anything about the follow-up support.
Yeah, I don't think we have anything kind of concrete to add at this point. I think it's follow-up supports initially is very connected to rapid rehousing. We do, of course, provide follow-up supports, or we have providers who are funded to offer follow-up supports that are not connected to rapid rehousing or other housing that's kind of available through coordinated access, and we'll have to take a look at that in the future, but I have nothing concrete to offer there yet.
Here's another length of homelessness question. Is the length of homelessness assessed the same for the youth equity group, or are there different parameters for youth?
So again, the young people, that's how we've built out by sector. That's the tool that's supposed to assist us in making sure that young people are not compared, at least in terms of their length of homelessness, compared to the adult population. But within the youth cohort, and a housing opportunity becomes available once we look at program eligibility requirements. We organize that by length of homelessness, but not in comparison to the general population specific to youth.
Okay, thank you. And have you gotten any pushback from community partners or public about the focus on And I'm hearing that you're not necessarily just focused on chronic homelessness. You apply your equity criteria and then use length of homelessness as one of your prioritizing factors. But have you gotten any criticism about the focus on chronic homelessness or longest length of homelessness? In that they're saying we sometimes receive criticism that it creates a pipeline to chronic homelessness by not offering support sooner. So I think the understanding is what other supports are offered for different groups who aren't chronic. Are there supports?
Yeah, that's a really good question. We spoke today specifically about prioritization as it applies to municipally administered housing. But also on the work ahead for this year is to build out what prioritization looks like across other coordinated access resources, including housing benefits. So this year we are expanding what used to be the housing allowance program, which is going to transition into the Canada Ontario housing benefit, and changing the chronicity eligibility considerations for that benefit so that we can also have resources for folks before they become chronically homeless. So we are trying to expand our view of that and match the housing resources accordingly, and prioritize housing resources to be more representative of the full breadth of folks who are experiencing homelessness.
I also think it's worth mentioning that definitely, in conversation for 2022 is work around prevention and diversion, which, also fits into this conversation.
Wonderful. And a couple of questions here about different lists and different housing options. So I think you've said some of this now, but just to clarify one more time, where do your housing opportunities come from? Is this supportive housing, housing allowance, housing first programs? Is Toronto RGI housing included?
Yeah, so what we spoke about today and those specific equity targets are for municipally administered supportive housing. We have done some initial work to broaden the scope of the prioritization policy to also include rapid rehousing, which is social housing with Toronto Community Housing. So that work is kind of in progress. And similarly for housing benefits, so the financial benefits, the principles to guide prioritization for those resources will be the same, but what those equity targets look like will vary by resource, and that's the work that we haven't, that is currently in its initial stages.
Okay. Here's a good coordinated access question. So can and you're working through this process as every community is. So can you summarize which places clients need to be added to in order to receive housing and support services? So they say, I know about the by name list, HTI, and maybe you could explain what HTI is, and housing applications online, but anything else. So I think they're just sort of sorting through what are all the places people need to go to access housing and supports right now.
Oh, I'm not sure, what is HTI? Sorry.
Yeah, I was actually going to ask the same thing.
Okay, I'm wondering if it's the Rapid Rehousing Initiative, but I'm not sure. So we'll see if that person adds in anything else. But I think essentially, right now you have the by name list, which you're coordinating access to some of your resources. There is still a centralized waiting list with your Toronto Community Housing. So
yep.
Yeah, but you're working over time to further link all of these pieces up.
Yes. And then of course there's the access point, like those are all sort of, HTI is information database. Oh, okay. So currently, yes, it's municipally administered supportive housing, and very likely by the end of this year, this policy will be inclusive of the partnership with Toronto Community Housing for the rapid rehousing initiative, but that will likely still remain separate from the application process for RGI housing. If that makes sense.
Yeah, it does. That's amazing. So outside of this presentation, someone's just saying, where can I find out more information about the process for youth homelessness? But it's also making me wonder, do you have like a guide, or is there something kind of written down or online that people could get further information if they were interested in general?
We haven't put, like, in terms of this process that we reviewed today, we don't have it online yet. But we are looking to build out our website that will include like the coordinated access website that will live somewhere in the City of Toronto website, and we will be posting, you know, all shareable materials on there. I don't have a timeline for that, but it is on our horizon.
I'm also wondering if it's worth just clarifying here that PATHS, which is what we discussed, the housing and supports opportunities we discussed today, are a rapid rehousing program which supports people, you know, to connect with rent geared to income housing through our partnership with TCH. Those are not referral based programs. Like, those are prioritization based programs, and so there isn't really like a pathway in that we can explain. Like, that's the really important takeaway there. But then with our housing allowances, there is a web, like you can definitely find information on how to connect to the housing allowances through the City of Toronto's website. We can share that link. Maybe Marie, we can send that to you, or I'll pull it up and plop it into the Q&A box, or the chat box rather, to help clients connect, if eligible, to the housing benefits that way.
Yeah, I think that's a really good point. Yeah, we say that Rapid Housing and PATHS is a reach-in program. We reach into the by name list as opposed to, you know, as someone being able to refer into it.
And to be on the by name list, excluding people who are sleeping outdoors with the workaround that we described. People on the by name list are that information is connected from our shelter management and information systems, Miss. Yeah.
People could refer in terms of getting on the by name list by accessing any of your access points.
Right.
So that's sort of how people get in, and then you're using that information around your prioritization.
Exactly.
And a question, and I know this is evolving and you're getting started with it, but how many people are you matching, or maybe have you matched so far to units through this program? They said every year, but I know this is like a newer and evolving process.
And I have that data, I just don't have it handy. If you want to continue, I can quickly try and pull that up.
Sure. I had a quick question, and I know you're working on I forget what you call it. I'm so sorry. It's sort of the decline match. I was curious about, so you go through the process, you match, you prioritize, you make the referral, and then the housing provider declines. I don't know how often that happens, and that sounds like kind of what you're working on now is sort of a policy and process around that.
Yeah, that's right. So what we do now is a kind of a case conference for each of those referral disputes, so that we can land on a really clear parameters about what makes someone ineligible, so that we're not making inappropriate referrals from the get-go. But currently our process is to connect with the housing provider for each match that we've made that is declined, and try to unpack that and understand if it can move forward or not.
That's great. Lindsay, you've put a link there in the chat for folks, and that's around the housing benefit. And either Lindsay's frozen or she's very deep in thought trying to find that data point. I think she's frozen right now. But what we'll try to do is, like, all the links and the things you've been sending and your previous webinars, we'll try to put that all together in sort of the follow-up email, so everything's in one place for folks.
Yeah. I want to say that last year.
Can you hear me now? Sorry.
Yeah, now we can hear
you're
you.
Frozen now.
Sorry about that.
Did you find it?
I can't access, because we're on Zoom. Unfortunately,
right.
I can't access my, we have a system that doesn't allow us to access things. I
want to say that
numbers,
last year was about 500, over 500 matches were made through the PATHS process. Right? Does that?
I think it was 528, if I recall.
Something like that.
Yeah.
Okay. Yeah, that's amazing. That's a lot. I mean, when you break that down on a monthly basis, or even a daily basis, I mean, so you flowed quite a few people, which means you've had quite a bit of experience now with this process too, and I'm sure that's helped inform your learnings and as you move forward. That's great. Well, I think I don't see any more questions coming through. Really appreciate our presenters' time and the rest of your staff that are on the call and all the resources that you're willing to share, and look forward to an upcoming webinar around some of the STARS tools. And we'll wrap it up here, I think. And again, thanks everyone for attending.
Thanks, everybody.
Okay, bye now.
Take care.